What do hot and cold thyroid nodules mean? Have you ever wondered what hot and cold thyroid nodules really mean? Thyroid nodules are lumps that can form in the thyroid gland, and they are classified as hot or cold based on how they behave during a thyroid scan. This scan uses radioactive iodine to see how well the nodules take up iodine compared to normal thyroid tissue. Hot thyroid nodules are those that absorb more iodine than the surrounding tissue. This means they are actively producing thyroid hormones. Because of this increased activity, hot nodules can lead to a condition known as hyperthyroidism. Symptoms of hyperthyroidism may include a rapid heartbeat, weight loss, anxiety, warm or sweaty skin, and an increased appetite. The good news is that hot nodules are almost always benign, meaning they are non-cancerous. However, if left untreated, they can cause complications like an enlarged thyroid gland, also known as a goiter, or even a multinodular goiter if multiple nodules are overactive. On the other hand, cold thyroid nodules take up less iodine and do not produce thyroid hormones. Most thyroid nodules fall into this category. Many cold nodules do not cause any symptoms, but some can grow large enough to create pressure in the neck, leading to discomfort, voice changes, or difficulties with swallowing and breathing. And like hot nodules, cold nodules have a higher risk of being cancerous. However, a thyroid scan alone cannot determine which cold nodules might be malignant. This is why further evaluation is often necessary. Doctors typically use ultrasound and fine needle aspiration biopsy to assess cold nodules more closely and rule out cancer. In summary, hot nodules are those that produce hormones and are usually benign, but they can lead to hyperthyroidism. Cold nodules, however, do not produce hormones and carry a higher risk of cancer, which is why they requiring additional testing. Both types of nodules may need monitoring or treatment based on their size, symptoms, and individual risk factors. Key tools for diagnosis and management include thyroid scans, blood tests, ultrasound, and biopsy. If you have concerns about thyroid nodules, it is always best to consult with a healthcare professional for personalized advice.